Hi there, my name is Dr. Kelly Clarke, and I was wanting to talk about ADHD, or Attention Deficit Hyperactivity Disorder. Years ago, ADHD was called Attention Deficit Disorder, and there was a hyperactive side as well to it, but nowadays it's just all under one category of ADHD, Attention Deficit Hyperactivity Disorder, but there's three subtypes. I know, and I'm going to get into details about what ADHD is, what are some of the characteristics of it, because it is quite a well talked about issue these days. A lot of people are wondering if they have ADHD. It's prominent on TikTok. So I thought I would discuss that a little bit. So what is ADHD? ADHD is a neurodevelopmental disorder characterized by excessive inattention, impulsivity, and hyperactivity. And pervasive, meaning that it should be in multiple contexts. You should not just experience that just at work, but you should see it in your personal life, in other contexts that you might be noticing a performance difference. And it should also seem to have an inappropriate or an age-inappropriate discourse. In other words, as a child is developing ADHD or is clearly presenting with ADHD, they should be functioning at a different level than most kids around them. So when I say a neurodevelopmental disorder, I mean exactly that it is a developmental condition. So it is a condition related to the brain, and a lot of the hypotheses out there is that there's an underproduction of brain chemical, typically dopamine, responsible for paying attention. So for people who struggle with ADHD, they have difficulties with paying attention, they can be impulsive, and they can be hyperactive. So one of the things that is also confusing is that it impairs functioning. And so for most people with ADHD, they're struggling in contexts like early school. So often parents will wonder, well, my child is having a difficulty in school. Also, we notice some things at home. So I'm going to talk a little bit about what some of the behaviors are. But again, the parent should notice it at home. The school should notice it at school. And as kids get older and turn into adolescence, it has a functional expression a little bit different, but still the basic criteria are similar right into adulthood. Even though, again, there's more hyperactive features when they're young, and the inattention, it tends to be more of the issue as people get older. Another thing is that about 20% of people diagnosed with ADHD before the age of 12 seem to or can grow out of it. So there's a large population that still retain the ADHD. So more about ADHD. What does it look like? I'm going to give a little bit of resources at the end. I'll talk about potential checklists. You know, if you're somebody listening to this and you wanted to see if you have ADHD, I can talk about some of the resources available in addition to seeing somebody like myself or your physician or a psychiatrist. So what are the characteristics of ADHD? On the inattention side, you should present with, before the age of 16, 6 or more of the inattentive subtypes before consideration is given to the inattentive side of ADHD. So things like having difficulties paying attention, getting easily distracted, forgetfulness. So oftentimes parents with kids with ADHD are thinking that, or even listening to instructions. They'll wonder if they've got a hearing issue because they'll tell them something and then they'll forget it. So it is both a listening issue. They'll think that, hey, I just told you this, and they'll go downstairs and, maybe to pick up clothes and get a toy that they asked them, but they'll forget the second one. So they struggle with listening to instructions spoken, and they'll make careless mistakes in them. They'll also be very forgetful. Where did I, put my pen, or where did I put my homework? I can't find this or that, mom or dad. And the same kind of behaviors are illustrated and observed into adolescence and adulthood as well. So this tendency to be forgetful, losing keys, misplacing things a lot. Those are some of the characters of being inattentive. Other features are having difficulty sustaining focus and attention on tasks that require mental effort. So there's a clear one in school. So kids that can only focus, and they're 7 years old, and the student next to him or her at 7 years old can focus for, say, a good 5 minutes. But your child or the child that is presenting with inattention can only focus momentarily, maybe even a minute or seconds at a time, depending on the severity. And they are off task and they can't focus and sustain attention. So the ability to sustain attention, avoiding tasks that require sustained mental effort. So activities that require a lot of mental effort, you'll notice that, as an adult or an adolescent or as a kid, they'll avoid it. They'll procrastinate. So procrastination is a common theme with people with ADHD. And they have a difficulty sustaining and also maintaining effort on things that require a lot of mental effort. So they'll avoid them. Leaving oftentimes things like homework to the last minute. So we'll see that kind of presentation as well. Difficulties with organization, again, related to inattention. So the ability to be able to focus and organize things in a brain that's struggling with paying attention, well, you can imagine organization requires the ability to focus on several pieces at the same time, or at least pay attention to them in a seriation. So kids and adults that struggle with organization often is because they're distracted. They're thinking about, oh yeah, I've got to go and clean up my room. But then another thought pops into their mind, so they get distracted and they can't keep focused on the idea, and that contributes to disorganization. So often you'll see the room's a mess, or things cluttered, or their life just seems to be, chaotic. These kind of activities are characteristic of kids and adults and adolescents with ADHD. Those are the inattention. Also having difficulties interpreting instructions, or they'll miss steps altogether if they're spoken to the person. Or another one, as I said earlier, listening to people. So they're the people that are kind of like zoning out. What did you say? Oftentimes people who are married will complain about that with their partner. I'm not talking about that while they're watching TV. I am talking about listening to people as a tendency, as a characteristic that they again and again show that they struggle with listening to people, and they zone out. Oh, what'd you say? And they're missing details. They'll need things repeated to them constantly. And so there's a lot of kind of corollary behaviors that I can talk about with ADHD as well, but these are what we call the behaviors in the Diagnostic Statistical Manual, 5th edition, that psychologists, psychiatrists, and medical experts use to make diagnoses of inattention, ADHD. So the next characteristic of ADHD is the impulsive side of it. And so with impulsivity, we're seeing people that cut people off while they're speaking. So all of us have probably run into the individual that while you're speaking, they cut you off, they interrupt you, and it's a bit annoying, right? So often, kids and adults that have ADHD, they don't mean to be, but they can frustrate those around them because they are impulsively cutting them off or interrupting. Another behavior that happens is patience. They don't have patience to wait their turn. Waiting in lines drives them nuts. Waiting in a long car line in your vehicle, getting really impatient because, again, that impulsive, it's hard for them to keep that emotional regulation when it's demanded. The other thing is blurting out answers before questions have been completed. So the individual, you might ask, hey, what'd you do this weekend? Before you get weekend out, they go, oh, I went to the store. So again, kind of blurting out answers, not letting you finish your sentence. Those are some of the impulsive characteristics. Of the hyperactive side, now again, with the hyperactive and impulsive side, I'm going to talk about the 3 types of ADHD. But the hyperactive and impulsive, we should have 6 or more of those behaviors up to age 16. After 17, 5 or more. And that characterizes that there's clearly an issue going on. So the hyperactive features are, restlessness, this excessive energy in their body, this boundlessness, you feeling this energized energy in your body. Another characteristic of the hyperactive side is fidgetiness, or you can't sit still. So, if I had the hyperactive side, I'd be moving in my chair, I'd be bouncing my leg, I'd be tapping my pen, I'd be playing with things. And, those fidget toys that they give to kids, they'll do that to help their hyperactive features kind of attenuate a bit because they can focus on that. So the hyperactive side is fidgety, can't sit still, has a tendency to get up and move around when remaining is seated. So just, we'll walk out of the chair. If you're a child and you have hyperactive features, just cannot sit still. And they get up and walk around without the teacher's permission. As an adult, you might notice they can't sit through a movie. It's really, you feel that energy and you've got to fidget and move around. So those are a lot of the features of the hyperactive side. Also, talking too much. So we've all run into people that talk too much. and we're looking at our watches as they're going on, and some of them are not aware that they're actually creating an inconvenience or it's uncomfortable for you. People with ADHD and the hyperactive features, they're just not aware. They just talk a lot, and they don't pick up on the signals often that it's creating some discomfort for the person they're talking to. So excessive talking, restlessness, these kind of features, and difficulties remaining seated, getting up and moving around, those are some of the hyperactive features of the ADHD. Now, when we're talking about ADHD, someone might say, well, I don't have any of those hyperactive or impulsive features. So there's 3 subtypes. One is the ADHD, and we would go ADHD inattentive type if they meet criteria just for lacking focus, can't pay attention, can't sustain attention, as I talked about in the beginning. So those people would have ADHD inattentive type. Of the type that just go, well, you know, actually I can focus really good in school, but my leg is always bouncing. I feel like getting up and moving around, and it's hard for me. I'm very restless, and I'm always on the go. That's another criteria, often on the go for hyperactive. Always got to be doing something. So with those individuals that lots of energy, always doing something, cutting people off while they're speaking, they can have ADHD hyperactive type or presentation. And then there's the combined type, which is both inattentive and hyperactive and impulsive features. So you can have ADHD combined presentation, inattentive presentation, and the hyperactive presentation. Now, to talk about how it's diagnosed, typically people like myself, like psychologists, physicians, psychiatrists will be the people that will do interviews, and they will make a diagnosis if ADHD is present. Now, there's no blood test for it. It's all based on behavior. And so a detailed history, most people with ADHD should have had it before, should have had symptoms before the age of 12. And so, you know, a long history of how they functioned, the individual as they're growing up functioned into adolescence and into adulthood. Or if they're a child, you know, a history of how they're behaving in the classroom. Should be also checked out and compared. So there's no blood test. We take a history and we look at multiple behaviors as I gave you the checklist. In addition, there are psychometric evaluations or measures that I would use. As well, physicians use checklists and these things. Usually it's in multiple settings. So at school, if it's a child, a school-age child, so it would be in school, or else, you know, if it was at work, you'd get maybe an employer to fill that out if the person's comfortable, or you'd get a wife or a husband or a romantic partner to fill out the inventory, as well as self-reports. So we have multiple pieces of information looking at different contexts the person's functioning in to make a determination if there's ADHD. So that's a quick synopsis of how somebody like myself diagnoses ADHD. As I said, you could go online if you're curious about that. And without me going into detail about that, I will say that you can take a look at drkellyclarke.com and contact me there, and I can talk about free inventories that you could take a look at if you're curious, and or, you know, further assessment with myself if you would like to have a determination if you present with ADHD. In addition, a quick comment on how to treat ADHD. The gold standard still to this day is medication, because again, the idea is that there's an underproduction of the neurochemical helping us to pay attention. So often medications in the form of psychostimulants, but there's lots of different brands or kinds of medication. Best to talk to your physician about that. In addition, there are compensatory strategies. So even if you're somebody who's not into medication, ADHD individuals start to learn to be able to cope and compensate for their challenges with ADHD. And those are strategies that, again, someone like myself can help to teach and inform, you know, as well as the ones that the person has already learned in their lifetime. And there's other treatment that is, you know, less proven in the research, like biofeedback, which has shown some benefit to individuals. But that's a quick synopsis on ADHD, how to diagnose, and some of the treatments that are out there. For more information, visit drkellyclarke.com. Thank you.